The numbers we were sharing are from the reporting period Tuesday, April 12th to Monday, April 18th. In those 7 days, our PCR test positivity ranged from 20.8% to 30.2%. As the Minister mentioned, there are currently 1,126 people with COVID-19 in hospital, including 43 in the ICU. Sadly, between April 12th and April 18th, an average of 7 deaths per day related to COVID-19 were reported to Alberta Health. These losses and others that have happened due to any cause leave holes in our families, friend circles, and communities, and my sympathies are with anyone who has lost a loved one. As transmission continues with BA2, we have seen more breakthrough infections in those with a full vaccine series. Given that, I know there are questions about the importance of vaccines right now, and I want to remind Albertans of what the data shows us. When we look at the difference in the risk of severe outcomes by vaccination status, it is very clear that vaccines are critically important in lowering the risk for hospitalizations and deaths. If we look at everyone in Alberta age 5 and up, in the last 4 months, those who were not vaccinated were more than 3 times more likely to be hospitalized with COVID-19 and almost 8 times more likely to be admitted to ICU than those who had 3 doses of vaccine. For those age 80 and older, in whom the risk of severe outcomes is highest, those who were not vaccinated were more than 4 times more likely to be hospitalized with COVID in the last 4 months and almost 6 times more likely to die from COVID than those who had 3 doses of vaccine. It has always been true that most people who get COVID do not need hospital care, and especially with high 2-dose coverage, at this point, the initial infection will be mild for most people. Some individuals may not even notice their symptoms until a couple of days have passed owing to spring and allergy season. Many may be tempted to shrug off these mild symptoms and continue to go about their daily business, to work, to run errands, to take part in regular activities. However, it's important to remember that doing this can have serious consequences for others around you.
We have certain areas of the province and in certain hospitals, so like the U of A, we have higher than normal 100%, over 100% capacity in terms of in terms of the emergency rooms. So we're conscious of that. We know that as overall as a system, we're not at that level. So it depends on the location. You know, some of that's being driven by COVID, and some of that's driven by the care deficit that we've had. You know, so we've had individuals who have over the course of COVID not seen their family physicians as frequently as they may have normally would, given concerns with COVID. Therefore, the acuity of the illness that they're facing has gone up, and then now they're coming into the emergency departments. So one of the things that we are doing with our budget is working to expand capacity within our hospital systems overall. In terms of, you know, we've done that with the ICU, $100 million and specific to that, and we've also asked that, you know, if we don't need those dollars for the ICU to be able to use the resources elsewhere and build capacity within the system. So we're recognizing that this is an issue. We'll work through it as we learn to live with COVID and through what the current BA2 wave. And then continue to build capacity so that, you know, we can, quite frankly, normalize. And not saying it's ever going to be normal, but we shouldn't have to be over 100% on regular times a year. And the only other context I would provide is that, you know, we are dealing with COVID right now, but also flu seasons. We've had to deal with this in the past, not as severe and not as high as levels, but we need to actually invest into our healthcare system, which we are doing, so that, you know, we don't have people doing a high dive to provide services all the time, but this takes time. So we have budgeted for this year and the next few years to be able to do that as we recruit and train more staff.